Well, for more, we are now joined by Dominic LeBlanc, Minister for Intergovernmental Affairs, who has been working the phones and negotiating with the provinces ahead of today. So, Minister, thank you for being with us tonight.
Thanks, Michael, for having me.
Now, as you well know, the premiers did have their own news conference this afternoon. They say what your government is proposing is not enough. They're disappointed. What's your response to that?
Our response, obviously, is that $198 billion of additional funding is a very significant investment. The provinces understand that there's a limited fiscal framework that every government has to work within. We have worked hard and talked to many of them, as you mentioned in the introduction, over the last number of months about what the Government of Canada could do to be the best partner possible in ensuring the long-term sustainability of our healthcare system. We made a number of adjustments to some of the initial ideas we had based on those conversations with premiers over a number of weeks and months. So we're confident that this is a very significant offer. And we're also confident, Michael, that Canadians expect us to quickly sit down together and figure out the best way to apply this additional funding in a way that will benefit the people who need the healthcare system, the people who work in the healthcare system in all of the different jurisdictions across the country.
Okay, but there is this disconnect between what the provinces were asking for, or hoping for before they got here. And when you talk about that nearly $200 billion investment, only $46.2 billion across 10 years is new money. And the premiers were asking $28 billion a year. Essentially, that's a gap of some $23 billion each year. If your intent is to protect public health care, how does your offer help the provinces actually do that?
But again, this is the trap of arguing about tens of billions of dollars. The Prime Minister noted that the tax points that we transfer to the provinces are worth $25 billion a year for the provinces and territories. That's left out of the calculation they use around this $28 billion. So all of these numbers, Michael, are interesting. It's interesting on programs like this. At the end of the day, the people who are in an emergency room at a hospital in Ottawa tonight or in Moncton, New Brunswick, where I live, want to know that we're working collaboratively with provinces and territories to come up with the best solutions possible to sustain the public health care system, to improve accessibility. We think this is a very significant amount of money. We think it will significantly improve the long-term prospect of the healthcare system. And we've built in the flexibilities for provinces and territories to tell us what are their priorities and how can this additional money help them meet those objectives that the citizens of their province and of our country expect us to attain together.
Mm-hmm. But when you talk about those figures and those projections, though, what is the percentage? I know there's a discrepancy between the way the provinces and the federal government measures percentage of what is actually paid. And if Canadians want to know that their federal government is cooperating with the provinces to deliver health care, what do you calculate now with these additions? What do you calculate to be Ottawa's percentage in paying health care in this country now?
So again, Michael, this is the accountant trap that we can fall into. The provinces and territories have said that they want the Government of Canada to pay 35% of the cost of public health care systems across the country. With these additional investments, we believe that we'll be within 1% or 2% of that 35% figure. There are other bilateral agreements around support for personal support workers in long-term care homes. There's money for Indigenous health equity, ensuring that some of the gaps around Indigenous health are met. So all in all, we think, Michael, that this is a generous and reasonable offer that respects the federal government's fiscal circumstance. These provinces, many of them are in big surplus positions. They know that the Government of Canada carried a very significant share of the cost of fighting the pandemic, not only in supporting their healthcare systems and buying the vaccines and so on, but in supporting Canadians and Canadian businesses. So that's why I'm not pessimistic that we will find the right way forward over the next few weeks to come to agreements with the provinces and territories. The Prime Minister has said that this amount of money will be available starting in the next financial year, which is a few months from now. We think the provinces will want to ensure that we get the right agreement so they can access this money and make some of the investments they've been saying for a long time that they need to make.
So will that money flow even if deals are not finalized before your government tables a budget?
The $2 billion immediate increase in the Canada Health transfer will flow to deal with some of the backlogs we see in emergency rooms, pediatric care centers, and so on. The money to provinces and territories in terms of the bilateral agreements will flow once we sign those bilateral agreements. But we believe, we're not pessimistic, we believe we can, over the next few weeks, come to the right agreements with provinces and territories. And of course, the Canada Health transfer increases are a function of the provinces committing to share in a transparent and comparable way data around outcomes that they themselves will set. And that part of the conversation is, again, very encouraging. Premier Higgs, the Premier of my province of New Brunswick, at the table with the Prime Minister earlier today, was one who said that one of the most important things of the conversation we're having today is how we can share comparable and reliable data with Canadians, with taxpayers, so they can measure the outcomes of the healthcare system that they're paying for. Premier Furey, Dr. Furey, the Premier of Newfoundland and Labrador, talked about the great work that's been done around the Canadian Institute of Health Information that's been built collaboratively with the provinces, territories, and the Government of Canada. So those are the things that we expect for the increase in the Canada Health transfer, but we think we can also sign those bilateral agreements in the coming weeks.
Okay, so you still have belief that it's possible, but you know the premiers, they will be meeting the days to come to talk about your offer, perhaps to counter it. So is there any wiggle room for the provinces?
I think the Prime Minister has been quite clear, Michael, that is what we believe is a reasonable and substantive offer, taking into consideration the fiscal circumstance, the financial position of the Government of Canada. We hope the conversation can move to how we can meet the priorities in their own jurisdictions, in their provinces and territories, with this additional money. This didn't set up a subsequent meeting for a back and forth. It's not somebody trying to buy a residential property somewhere. The Prime Minister was clear with the premiers that we have worked hard to get to what we think is a very significant offer. It is $198 billion of additional money as compared to last year over the next 10 years. But that is additional money that was not available last year. So this is a significant, if not massive, investment to try and deal with a huge problem, a significant problem. So we think we're being a good partner, and we think we can be flexible and accommodate provinces and territories in terms of their own priorities, and do what Canadians expect of us, Michael, is to get quickly down to work to invest this money in some of the real pressures in the healthcare system. And I think Canadians won't be very generous to any of us that aren't trying to get to the right agreement quickly.
So look to this ideals, the money is what it is?
The $198 billion is what it is. It's a lot of money. It's a great deal of money that Canadian taxpayers are contributing in terms of additional incremental investments in a public healthcare system that we all care deeply about as Canadians. So I'm not pessimistic at all about our ability to find the right way forward with provinces.
Minister LeBlanc, really appreciate the time. Thank you for this.
Thank you, Michael. Have a great evening.
You too.